Morning, Hugo, and also to the viewers. I think it is clear to a certain extent. Remember, when we talk about analysis of healthcare systems, we rely highly on data. And we all know that, of course, the data that we get is really based on whether or not there are resources and also human resources to adequately capture what the challenges are. So, for example, when we talk about provinces like Gauteng, there would be certain pockets where they're most likely to be able to get timeless data. Whereas if we go more towards rural areas, like your Eastern Capes, etc., there may be areas where they are desperately faced with challenges, and information doesn't really trickle down to those of us who then can actually aptly respond the way they should. That being said, however, I do feel that the information that is being given is pretty much adequate to give an overall estimate of what the terrain is like for human resources, and what the ongoing mitigation strategies or support plans should be for human resources. Bearing in mind that we are well aware of what healthcare human resources are like in South Africa. We know we don't have enough. We did not have enough prior to COVID, and COVID has certainly made that worse. We know that we cannot churn enough of the higher category of healthcare, being professional nurses and also medical doctors. And that's exactly why we need to start tapping into your lower middle level workers, your clinical associates, and other support staff that are supposed to really bolster the health system. And of course, we know that when we come to South Africa doesn't only cater for South Africa only, it caters for also the surrounding borders who are also in need of support, of course. Bearing in mind that in SA, we also do grapple with the fact that we've got multiple tiers of socioeconomic spectra. And it's the lower tier that is the one that is most in need, the one that has the ability to rapidly spread infections. In this case, we're talking COVID, but we know there's multiple others as well. And the one that often doesn't get access on time.
Now, we talk about 400 healthcare professionals having lost their lives. 400 is obviously 400 too many. Would you think that any of these deaths could have been avoided?
Hugo, I think hindsight will always tell us that yes, some of the deaths could have been avoided. But remember as well, we could not really prepare for the pandemic and mitigative strategies thoroughly. Of course, we do know that there's been unfortunate events such as PPE, which has not been allocated timelessly to the healthcare professionals. And that, of course, has then unfortunately resulted in many of our healthcare professionals being exposed to COVID-19. Of course, as well, we had a situation where healthcare professionals had to go out and work on patients who had COVID-19. And, in terms of mode of spread and mechanism of spread, there was still not clear, definite certainty on it. There was a lot of question of, is it just contact spread? Is it airborne? What PPE do you need? There'd be scientists who would be pro, healthcare professionals wearing the suits such as the ones you have on the screen. And then there'd be those who'd say, well, you really only need more of your aprons and your N95 for aerosol generating procedures, etc. So I think, unfortunately, when it comes to pandemics, and we've seen it with every other pandemic as well, whether it was Ebola, whether it was, blood contact with HIV as well, healthcare professionals, because they are the front line of individuals who will deal with something that is deadly at the beginning. We do have multiple of us will then be exposed and unfortunately demise. But I think what is also critical to understand is you wouldn't really get any governing structure that would really expose healthcare professionals to danger deliberately. It is unfortunate that there are certain systems that could have been done much faster, such as giving adequate PPE to those who need it, that could have prevented the demise of professionals. But I think it will also be unfair to completely put the blame on government and to say that they willingly withheld certain resources that were there to protect the healthcare workers.
Now, human capital is obviously one of the areas that we need to look at. There's fatigue, exhaustion, and just loss of morale in the health sector. How are you dealing with this, and what can be done?
Absolutely. I think the first thing is, so we would look at the mental state of the healthcare workers and support systems to help them. Those are the short-term interventions that one would look at. So you look at hours that healthcare workers would look at, would be working at, the shifts and the rotation of the shifts. And also having programs where there'd be debriefing for healthcare workers, because there is nothing more traumatic than losing a patient. And there's nothing more traumatic than losing patients and colleagues and family members in numbers. And this is what's happening at this moment in time. But what is absolutely crucial is in South Africa, we need to move towards more sustainable solutions than long-term solutions. So, for example, how are we going to ensure that when the next pandemic comes, whether it's 15, 20, 30 years from now, we don't find ourselves in a situation where we're grappling so desperately with human resources that's not there? What are we going to do to address the fact that we cannot create enough doctors and nurses? However, there's ample number of people that can be taught the basics in healthcare, how to screen, how to look for certain signs and symptoms so that it can then be referred to the healthcare professionals that can do further diagnosis and treatment. This is what we need to look at. We talk about the fact that we have a lot of people who are unemployed. We have a lot of youth that are at home, some of them with very high degrees. We need to start really looking at systems and programs that will actually utilize and tap into these resources so that we don't find ourselves having high demands from a medical perspective with very limited supply from a human resource perspective. Communities as well. If you're sitting there wondering what it is that you can actually do to support healthcare workers, you could have basic days where you rotate, just speaking to the management of your healthcare facilities in a way in which you're also protected, give various things, refreshments, etc. These are the things that we can actually do to really try and encourage and to give hope to healthcare workers, because at a time like this where you're severely drained and you're severely exhausted, and you have desperate family members who are coming to you and screaming and shouting for help, I think you can sometimes feel that you're very underappreciated. And I think these are some of the psychological challenges that our healthcare workers are facing at this moment in time.
Well, Dr. Majake, we certainly appreciate your time this morning.